growing trend is the acceptance of insurance risk by healthcare providers desiring to gain greater control over patient treatment decisions. Many accountable care organizations, or ACOs, are now considering risk-based financial arrangements. And although ACOs are only recent innovations, provider risk management is not a new phenomenon. In the early 1980s, many health maintenance organizations and independent practice associations were formed by hospitals and physicians with similar goals. In the majority of cases, risk-taking providers were inexperienced and ill-equipped. They became insolvent over time and abandoned or sold their ventures. A key reason for their failure was the absence of risk management software tools to help them stay within the financial constraints of their risk transfer agreements with insurers. As we enter into a second age of provider risk-taking, I would like to share with you my first-hand observations from earlier efforts so these failures are not repeated. There are 5 best practices to help providers successfully manage risk. First, as in most businesses, financial success in risk management depends on collecting all of the money to which the ACO is entitled. Tools to reconcile monthly per capita fees received from a risk contract are critical. Second, it is important that risk-taking providers be reimbursed for services using a method that aligns their individual economic incentives with the cost containment goals of the ACO. Fee-for-service reimbursement should be used sparingly and replaced with alternative payment methods such as severity-adjusted case fees, encounter fees, and global budget allocations. It is also important that claim payment systems be architected to support these options. Third, to ensure that claims for services are properly charged to the ACO, an automated risk allocation audit should be developed to analyze each claim service line. As most agreements do not transfer 100% of the insurer's risk, it is critical that only claims for services that are covered under the risk transfer agreement are charged to the ACO. Fourth, identifying and modifying inefficient patient treatment practices is the most important day-to-day activity of a risk-taking ACO. Provider profiles should be created using peer comparisons of average patient costs. Lastly, a 5th best practice is that ACO administrative overhead should be minimized by replacing paper documents and phone calls with robust web portals for claim submission and payment. The ACO must offer world-class customer service to its participants. At Wonderbox Technologies, we understand the critical elements of successful medical risk management. Our enterprise system has been built from the ground up to support all of the best practices. I encourage aspiring risk-taking ACOs to reach out to our experienced team and learn how we can help you achieve success. To start the conversation, visit wonderboxtech.com and click on Contact Us. And please tune in to more videos in this series to discuss opportunities to deliver better healthcare to more people at a lower cost.